Hello guys, welcome to my channel. Today's topic is about monkeypox. So without wasting much time, let's see what causes this virus, what are its symptoms, and how we should deal with it. So guys, monkeypox is an illness caused by monkeypox virus. So it is nothing but it's a viral zoonotic infection, meaning it can spread from animals to humans, and it can also spread from person to person. So, if you see recently, WHO, that is World Health Organization, declared monkeypox outbreak a public health emergency. So, why it is called public health emergency of international concern? So, the WHO defines it as it's an extraordinary event. So, WHO defines it as an extraordinary event which is determined to constitute health risk to other states through the international spread of disease. That is, it is constituting a public health risk to other states also, and there should be coordinated international response to mitigate this virus. So let us see some of its symptoms. So the most common symptoms of monkeypox include fever, headache, muscle aches, back pain, low energy, and swollen lymph nodes. And this is followed by, the important thing is, the rash, which can last for 2 to 3 weeks. It can also be found on the face, palms of the hands, soles of the feet, eyes, mouth, throat, genital or anal regions of the body. So the number of lesions can vary from 1 to several thousand. So the number of lesions, it can range from 1 to several thousand. So the lesions being flat, then filled with liquid before they crust over, dry, dry up and fall off with a fresh layer of skin forming underneath. So how monkeypox spreads? So it spreads from person to person through close contact with someone who has a monkeypox rash, including face to face, skin to skin, mouth to mouth, or mouth to skin contact, including sexual contact. So the environments can also become contaminated with monkeypox virus. For example, when an infectious person touches clothing, bedding, towels, objects, electronics, etc., and some other person touches the same towel, clothing, he can develop monkeypox virus. Lesions or sores in the mouth can be infectious, meaning the virus can spread through direct contact with the mouth, respiratory droplets, and possibly through short-range aerosols. It can also spread from someone who is pregnant to the fetus, after birth to skin contact, or from parent with monkeypox to an infant or child during close contact. Although the asymptomatic infection has been reported, it's not clear whether people without any symptoms can spread the disease or whether it can spread through other bodily fluids. So the research is underway to find out more about whether people can spread monkeypox through the exchange of these fluids during and after symptomatic infection. So how monkeypox spreads from animals to humans? So it can spread from people when they come into physical contact with an infected animal. So the animal hosts include the rodents and primates. So how we can reduce the risk from catching monkeypox? It can be reduced by avoiding unprotected contact with wild animals, especially those that are sick or dead. In endemic countries where animals carry monkeypox, any foods containing animal meat or parts should be cooked thoroughly before eating. So recently, this has been the main issue, that is the relation between monkeypox and sex. So the monkeypox can spread through close contact of any kind, including kissing, touching, oral or penetrative vaginal or anal sex with someone who is infectious. So anyone with new and unusual rashes or skin lesions, they should avoid sexual contact until they have been checked for sexually transmitted infections and monkeypox. So while the monkeypox virus has been found in semen, it's not currently known whether monkeypox can be spread through semen or vaginal fluids. So the people with monkeypox, they are advised to use condoms for 12 weeks after they recover. So if I have monkeypox, what should I do to protect others from getting infected? So first, isolating in a separate room, then using a separate bathroom, cleaning using a separate bathroom or cleaning after each use. So the cleaning frequently the touch surfaces with soap and water and the household disinfectant and avoiding sweeping, vacuuming, etc. So using separate utensils, towels, beddings and electronics. So do your own laundry. Opening windows for good ventilation, encouraging everyone in the house to clean their hands regularly with soap and water or an alcohol-based hand sanitizer. So is there any treatment for people with monkeypox? So they should first follow the advice of healthy care provider. Then symptoms they normally resolve on their own, but without the need for treatment. If needed, medication for pain and fever can be used to relieve some symptoms. So it's important for anyone with monkeypox to stay hydrated, eat well, and get enough sleep. So people who are self-isolating should take care of their mental health by doing things they find relaxing and enjoyable, staying connected to loved ones, using technology, exercising if they feel well enough and can do so while isolating, and asking for support with their mental health if they need it. So people with monkeypox they should avoid scratching their skin and take care of the rash by cleaning their hands before a doctor touching lesions and keeping skin dry and uncovered unless they are unavoidably in a room with someone else, in which case they should cover it with clothing or a bandage until they are able to isolate again. So the rash can be kept clean with sterilized water or antiseptic. Salt water rinses can be used for lessons in the mouth, and warm baths with baking soda and Epsom salts can help with lesions on the body. So lidocaine can be applied to oral and perianal lesions to relieve pain. And finally, stop watching the mainstream and finally stop watching mainstream media channels which are spreading fear among people. So if you like the content, don't forget to like, comment and share. Thank you.